This is Mary, or Maria, or Navia, or Liju. She lives in a small village far from the capital city and has just woken to the sound of her child coughing and crying. She knows that her child is not well, and she isn't sure what to do.
Do I have any medicine at home? What medicine do I need? Should I go to the drug shop in the next town? Or travel to the health center 25 kilometers away? And what medicines can we actually afford?
Mary's dilemma is not uncommon. In low and middle income countries, medicines are a leading cause of catastrophic health spending. They can impact savings, borrowing, and sales of assets. For over half of LMIC households, medicines expenditures represent 100% of all money spent on healthcare. 60% of total LMIC expenditures on pharmaceuticals are paid out of pocket. For example, the standard treatment of respiratory infections with generic ciprofloxacin costs over a day of the average LMIC minimum wage. Mary decides to visit the private drugstore. The clerk there asks good questions about her child. After determining the severity of the problem, he refers her to the health center. This is a tough choice for him, though. Selling this woman medicine puts money directly into his pocket, but he knows it's not the right decision. The government recently offered him and other shop owners training and treatment guidelines, stock management, and medicine's efficacy. He knows he cannot diagnose this child appropriately, nor can he treat her as effectively as the health center. So he forgoes an easy payment to help this woman get the best care for her child. The referral does not put Mary at ease, however. She knows that children, a lot of them, die from exactly these symptoms. Her neighbor told her that an injection is the only thing that really works. At the same time, however, she knows that if she goes all the way to the health center for medicine, she'll miss work for the day. But her child is sick, and she knows she needs something before the cough gets any worse. Following a long and crowded bus ride, Mary waits for hours at the health center to be seen. The doctor listens to the child's lungs and to Mary's request. If this child has mild pneumonia, an injection is certainly an option. But of course, there's the possibility that prescribing nothing except rest is the best course of action.
Often, health providers and LMICs,
Without sufficient diagnostic tools, cannot distinguish between viral and bacterial infections. Lack correct information about when medicines, like antibiotics, are in fact needed. Face high and often inappropriate patient expectations for care, and are pressured by the strong incentives of pharmaceutical companies. Every actor in a pharmaceutical system makes their own rational choices. And these decisions all have strong consequences on the availability, access, use, and affordability of medicines. Health system decision makers must ensure medicines are registered, controlled for quality, and available at the lowest possible price to all who need them. National health insurance authorities must provide the right incentives so that prescribers are effectively compensated for doing the right thing. Manufacturers need to balance high quality with profit. Distributors need to ensure robust supply systems so that medicines get to all hospitals and health clinics. And patients must better understand their rights and their treatment options. Thinking in systems allows us to situate medicines against the full complexity of a health system, because access to medicines is so much more than simply a series of interactions between patients and public health services. When we think in systems and see all the connections that lie behind the daily interaction between patient and prescriber, we start to see the system's real problems. And we come to understand that if we are to know each other's perspectives and start to work together in creating solutions, We need the support of the health system in so many ways. It's people who generate information for decision making, who monitor product quality and trust primary healthcare centers to provide quality services, who prescribe appropriately, who incentivize the right series of actions. It's people who make health systems learn and grow. It's people who make health systems stronger and take us closer to the goals of universal health coverage. When we start to think in systems, when we make decisions that help systems function smartly and effectively, when we do this, it's people like Mary who benefit. They now have the best and most informed choices in front of them when their child is ill. For more on medicines and health systems, please see the most recent flagship report from the Alliance for Health Policy and Systems Research.